All right, welcome back on this World AIDS Day, commemorating, of course, looking at the strides that have been made, as well as some of the challenges that are being experienced in terms of the HIV and AIDS program. And of course, we were speaking a bit early on, just before the break, to Dr. Izukanji Sikazwe, who is the co-chair of the African-led HIV Control Working Group. And now we're joined by Dr. Yogan Pillay, who is the Director of HIV and TB Research at the Bill and Melinda Gates Foundation. Dr. Pillay, thank you very much indeed for joining us. I'm sure our colleagues are going to show you on the screen in just about a moment. And, Dr. Pillay, the financing of the HIV response going forward is quite a conversation that has been had now for quite a while. The US administration, the potential of reducing funding, that is one of the concerns that are being addressed at this particular stage, or are being looked at this particular stage, in particular, with the new US administration.
Thanks very much, and good morning to everyone, and to my colleague Zuzu as well. No, absolutely. The truth, though, is, no donor is going to fund a program in perpetuity, so it was always on the cards that the American government will start reducing the amount of funding for the HIV epidemic. It's also in the context of many countries having reached some of the targets that have been set globally, the so-called 95-95-95 targets. Some countries have already started increasing domestic funding. South Africa has always funded its program to 80-85%. Countries like Kenya are beginning to fund their program as well. It's important for countries, for their own sovereignty to also fund their own programs, noting the challenges in many of the countries in Africa. So, we've known for a while that the American government, even preceding the elections, were thinking about starting to ask countries to increase the amount of domestic funding that they put into the HIV program. But that might accelerate going forward. Yeah. And as the Gates Foundation, we are working closely with both PEPFAR and the Global Fund to look at how we can mitigate the impact, of funding cuts, what we should be prioritizing going forward so that we don't roll back the gains that have been made in the last 30 years.
Yeah. Let's come back to where we are in terms of, HIV and AIDS. I mean, in South Africa, there's still a large number of infections. I think when we spoke a bit earlier on, you were saying between 140,000 and 150,000 a year. Those are the new infections. Is that correct?
That is correct. That is correct. And we obviously need to get to zero, which is not quite possible, but we certainly need to get to something like, 40,000 a year or so by 2030. Because, every person who is HIV positive and not on treatment will transmit the disease, has the potential of transmitting the disease to somebody else. And that's why the numbers of infections are monitored very closely, the new infections monitored closely. And that's why we need to focus more on prevention, right? Even as we're focusing on getting people on treatment, we can't forget about preventing HIV infection.
Yeah, of concern also, the gap between those on ARVs and those who are not. The difference in numbers, about 2 million people who are HIV positive and are not on treatment. This is certainly an element or an area that also needs to be addressed.
Oh, no question, no question. So we have, an estimated just under 8 million people living with HIV in the country, of which about 5.8 million are on antiretrovirals. And, the good thing about that is that you take your meds every day, you're virally suppressed, you feel better, you're productive, and you're not transmitting the virus. Challenge is the people who cycle in and out of antiretrovirals, meaning they get onto it and then they stop for a while, they then get back onto it. And that's not good for the individual or their loved ones. And then the second part is that we still have a large number of people who are either never tested but HIV positive, or having had a test, have tested positive, and for one reason or another, have not been initiated on antiretrovirals. And, those are the people that we're quite worried about, both for their own health, because, they can easily get advanced HIV disease and the mortality then gets very high, and also contract TB, because the immune system is suppressed.
Yeah. I think that's where we're going to have to leave it. Dr. Izukanji Sikazwe, who is the co-chair of the African-led HIV Control Working Group. Thank you very much. We, of course, had a conversation with you a little bit earlier on, just before, Dr. Pillay had joined us, and Dr. Yogan Pillay, who's the Director of HIV and TB Research at the Bill and Melinda Gates Foundation. Thank you very much indeed to the both of you for engaging with us on this World AIDS Day. All right.